So 50% of women have some kind of issue at the pelvic floor. Should we all be going proactively to a physical therapist or a specialist
In
to
my
find out?
Right. In my dream world, yes. It would be,
Okay.
and I talk about this in the book. If going to a pelvic floor therapist could be like going to the dentist, I think we
Okay.
would prevent a lot of issues because it would be
Wow.
proactive. It
And
would
so
be
what would happen when you go to that appointment? What
So what we do is we chat. I'm going to ask you everything, Tamsin, about your peeing habits, your sexual health, your bowel habits, if you've had babies, what your exercise routine looks like, and just get a lot of information
Mhm.
to see if there's anything I need to screen for. And then I do an external assessment. I look at your low back and your hips, just like a regular physical therapist. And then to assess the pelvic floor, we do an internal vaginal exam. So that's how we access the muscles. And we ask you to squeeze and do a Kegel contraction, relax. We check if there's tension or spasm in the muscles. And that just gives us a good idea. Is there weakness? Is there tension? Is there incoordination? And then we can help guide you with exercise.